In Europe, 2021 ends as it began, battling a new wave of coronavirus infections. In January, the Alpha variant, first detected in Britain, was dominant. By the end of January, Britain had the highest death rate per capita in the world. Much of Europe returned to lockdown.
The government is once again instructing you to stay at home.
But there was hope. Britain had already begun rolling out a mass vaccination programme using the Pfizer-BioNTech jab. It was a scientific breakthrough at unprecedented speed.
When the vaccines first hit the clinic, there was great hope about driving down the numbers of serious infections, hospitalizations, and consequently deaths. And that happened. We were in the middle of a big wave of infections, but we could see light at the end of the tunnel.
Europe saw a deadly third wave of infections in March amid accusations that the vaccine programs were too slow. Some countries suspended use of the AstraZeneca vaccine over blood clot fears, which many scientists say were overblown.
Of the 330 million vaccines doses that have been deployed, we are not aware of any one confirmed COVID vaccine-related death.
By early summer, immunity was building in European populations, and by June, much of the continent had reopened. But the virus continued to mutate. India suffered a deadly wave of infections driven by the newly mutated Delta variant. It soon reached Europe, and by the fall, Delta was spreading rapidly through schools. The World Health Organization once more declared Europe the epicenter of the pandemic. But the vaccines worked. While infections were high, deaths were relatively low. But in November, South Africa reported a new, seemingly far more infectious variant, Omicron. It has now spread to Europe and much of the world. In response, governments have ramped up vaccine booster programs, offering third jabs to all adults.
How this variant interacts with the boosted population is still something we don't know a lot about, and we're not going to for probably, I think, 3 or 4 weeks. Another scenario that we could see, maybe in addition to a lot of hospitalizations, is a mass sickness. So a lot of people in the population getting unwell and needing to convalesce at home.
That would have big effects on healthcare systems and the economy. Scientists say the cycle will continue until a much higher proportion of the global population has been vaccinated.
So far, only 102 million Africans in Africa, or 7.5% of the continent population, is fully vaccinated. More than 80% of the population has not received even a single dose. This is dangerously wide gap.
Dangerous for Africa and dangerous for the whole world as new variants continue to emerge. As the pandemic enters its third year, it's still not clear how or when it will end. Henry Ridgwell for VOA News, London.